questions or experience any glitches, we'll be able to support you. Next slide, please. Just quick overview about who MDoc Healthcare is. I started this session by saying that this session is hosted by MDoc Healthcare. Essentially, we're a digital health social enterprise, and we are focused on providing self-care support for persons who are living with either chronic health conditions or regular health needs like the pregnant woman. We leverage quality improvement, technology, data, and our goal is to ensure that people have are empowered to be able to advocate for the rights, advocate for their health care, and live healthier, happier, and more productive lives. We leverage a four-pronged approach, which is the first of which is our flagship Complete Health app, where members have access to coaching. It's a coach-led app where you have access to coaching and multidisciplinary support across fitness, nutrition, mental health support. You can track your health metrics, and you can work together with your coach to achieve your personalized healthcare goals. In addition, we also have our Navi Health app, which is where members can leave reviews, can get access to, we call it the Google for Healthcare. Okay, so on that platform, you can look for facilities nearby you, providing the support that you need, the care that you need, and you can leave reviews on your experience of care afterwards, which can be used to drive further improvements. Additionally, our platform, the MDoc Quality Network, which is the platform through which we're delivering today's session, is our capacity building platform for building the knowledge and capacity of both healthcare workers and even our members like you who joined us today. And then lastly, to support our digital approach, because we're a digital technology-focused organization, we have what we call the phygital approach, which is physical hubs and community centers where members can go into receive in-person support from their coaches and track their health metrics. We're going to take a quick play a quick video just to see how you can get onboarded on our completed app and begin to receive coaching support from us. Thank you very much.
This video is a brief walkthrough through our Complete Health mobile application. When you download the app, it takes you to this page, and then you can choose to either sign up or log in. To sign up, please include your first name, your last name, your email address, your phone number, and a unique password. Ensure that the password is strong, it is unique, and it is imputed twice. After that, you can now create an account. When you click on create an account, a verification code is sent to your phone. Kindly input the verification code and your account will be active. Now you can proceed to fill in your profile. In your profile, you need to fill in your gender, your date of birth, your height, and your weight. Your height and your weight are necessary because this is required to calculate your BMI, which is your body mass index. And after that, you fill in your level of education and your income level. So after signing up, the next thing to do is to subscribe for a program. To do this, please go to the home page and click on your name. After that, click on profile information and then click on subscriptions to the right. This will take you through a list of the available programs at MDoc. So for the purpose of this video, let's select Propel and we'll select free version and click on checkout. Checkout confirms payment and immediately takes you to fill out a BLA, which is your baseline assessment. After filling the BLA, you'll be automatically assigned to a health coach. Now, to confirm your subscriptions, please go to your homepage, click subscriptions. This will show you the list of all the programs you subscribe to, highlighted in green. You can click on the programs to find out your assigned coach and also retake your BLA if you fail to do so initially. Thank you for watching this video. This video is
All right, thank you so much. Apologies for the slight pause there. There was just a little technical glitch. Welcome. Thank you, everyone. And thank you. I'm sure you heard from that quick video on how you can subscribe, download, and be a part of the amazing benefits that MDoc has to offer. If you have further questions, we'll be in the chat. We can provide support. We'll also share the link. For Android users, you can download from your Google Play Store. For iPhone users, we'll share the link for YouTube. Can you still hear me, Dorothy? I just saw your comments.
Yes, yes. Yes, I can.
Okay. Is there still a lag? Is there still a lag?
No, I can hear you now.
Okay,
Yeah.
great. Apologies. Okay. Thank you so much, everyone. So we'll go right into the pre-quiz, and then we will begin to take participants. So just so that we can measure, we'd like to encourage everyone who's in the room, please make sure that you participate and take the pre-quiz test. Dorothy, over. Thank you. All right, the pre-test quiz is up. We want to encourage you to please make sure that you participate. If you're just joining us, we're taking the pre-test quiz right about now. If you're having challenges seeing the pre-test quiz, please look to the bottom of your screen. There are 3 dots. If you click on that more, the poll should pop up and then you'll be able to take it. Well done, well done. Thank you, everyone. Please like to encourage everyone. Please make sure that you are taking the pre-test quiz. Thank you, everyone. If you're just joining us, we're currently taking our pre-test quiz. We'd like to encourage everyone in the room, please participate in taking the quiz. Don't worry, the questions, just 7 questions. And your responses and feedback will be anonymous. Thank you so much. Thank you to everyone who's already begun to fill the pre-test quiz. Want to encourage more people to try and fill it before we move on. It's very important that you take the pre-test quiz so that we are able to measure knowledge gain or improvements after the presentation. Once again, thank you for joining the session. If you are already in the room and you'd like someone to still join or participate or gain from this amazing session, you can please, the link to register will be dropped in the chat box as well as the live stream link so that more people can participate and benefit from this session. So please look out for those links. Don't give out your own link, but look out for the link in the chat to for other people to join and share. Thank you so much. Please keep your answers coming. We're almost there. We'll be rounding off the polls shortly, but we want more people to contribute. All right, so we're rounding off right about now, and we'll go right into the next item on our agenda. Please, Dorothy, over next slide, please, and then we can go from here. Awesome. It's our pleasure. We're truly excited to have today's session and to have our guest speaker in the room who's waiting to take us through, Dr. Kunle Megbuvawan. My apologies if I didn't do a good job pronouncing that name. But thank you so much, sir. He's the CEO, Orange Health Initiative, Country Director, Sustainable Access to Health in Africa, Healthcare and HMO Health Insurance Manager, Farm Access Foundation, and former Group Head, Clearline International HMO. Dr. Kunle is a resourceful, versatile, and certified project management professional. He's also a business administrator, a public health and family medicine specialist with almost 2 decades hands-on experience, spanning clinical care, healthcare administration, financing, managed care, marketing, health promotion, as well as project and program management. Who better to handle today's session than Dr. Kunle, right? He has held strategic positions at the MeCure Healthcare Limited, Mobi Health International, Eco Hospital PLC, Farm Access Foundation, Clearline International HMO, and Healthcare International HMO, where he was a transformation and resourceful leader. He also volunteered as the country director of Center for Sustainable Access to Health in Africa, where he led young Africans in providing access to affordable health. He had his first degree in medicine from the University of Ibadan, a postgraduate diploma in family medicine from the National Postgraduate Medical College, 2 master's degrees in business administration, as well as a public health degree MPH from Babcock University, and is currently in pursuit of his doctoral degree in public health from Babcock University. He was certified by Project Management Institute PMI and has attended several courses in quality in healthcare, leadership, marketing, research, epidemiology, and project management, among several others. Ladies and gentlemen, I want to encourage you to please, with a standing ovation, sitting ovation, line ovation, I want to see in the chat claps as the Kunle comes to take his presentation. If you don't clap, he may change his mind, so please clap. I want to see all the whoops, all the balloons and the pom-poms in the comment section and the chat box as our guest speaker, who is on standby, comes to take today's session. Dr. Kunle, good afternoon, sir. You're welcome. Handing the mic over to you right about now.
Thank you very much.
Thank you very much.
Good afternoon, everyone. I don't know if you can hear me.
I can hear you clearly. Thank you, sir.
All right. It's my pleasure to be here and to share experience and knowledge with each and every one of us, how to ensure that spending and planning for our medical bills and medical health in general. Okay. Can we start the slide? I've been introduced. My name is Dr. Kunle Neguawo. I've been privileged to be in the healthcare space for some time now. I've been privileged to go around the various healthcare sectors, from the public healthcare to the private, to the HMOs, to Farm Access, which is an NGO, to diagnostic center, and to NGO. And now I run my own hospital and my own NGO. So I will say I'm in a position to be able to speak from the HMO angle. I can speak from the private hospital, the diagnostic, the NGO angle. So I understand what the patient wants, and I understand what the providers as well also want. Now in healthcare, there are two segments. There's the supply side and there's the demand side. Now, one of the things that is our issue is that the demand and supply, they don't meet at an equilibrium. The people want healthcare. They want quality healthcare. However, the suppliers of labor, the suppliers of healthcare want it at a higher cost. So you have a hospital, but the people cannot go to the hospital. Why? They cannot meet at the middle because of cost. And this is exactly what is happening in the case of Chidima, who is a single mother who has a young toddler. She noticed that her son Toby has recurrent cold and catarrh, and that sometimes he struggles to breathe. She took him to the general hospital, and the test results showed that Toby has asthma. Chidima is struggling to make ends meet with her job as a sales girl. What can she do? Let's turn it around. Let's tweak it around. Chidima is pregnant. Chidima registered for antenatal at the local hospital. The antenatal is not so expensive, but unfortunately, by the time Chidima is going to deliver, the baby, instead of coming with the head, is coming with the face. So baby cannot pass through the vaginal canal, and then baby is struck. And they said, look, Chidima, you cannot deliver this baby by normal delivery. You cannot deliver like the Hebrew woman, where you need to do a cesarean section. And cesarean section in this time will cost minimum of 350, 400, 500,000, standard hospital. Now, Chidima is a sales girl. What does she do? In the middle of emergency, the husband is not so buoyant because there is no adequate plan. She doesn't have a health insurance. She is paying out of pocket. So Chidima and her husband will sell everything they have. They will beg their employers. They will beg, go to the churches and plead for mercy. They will be begging the doctors to reduce the cost. Now, what is happening here is that the issue of poverty, illness, poverty syndrome. Chidima doesn't believe she's poor, but in today's Nigeria, she's poor. Majority of Nigerians, as at today, are living below poverty line. So when health emergencies come, they cannot afford to make payment for it. So Chidima delivered by cesarean section. The hospital was kind enough to go ahead, brought out the baby. Baby is fine, Chidima is fine, but Chidima cannot pay medical bills. So Chidima is at the mercy of the hospital. The hospital said you cannot go because you have to make payments. The husband of Chidima, who is a young man, is running health care, asking for loan here and there, asking his employer, who is also thinking, this man is not an asset to me, let me lay him up. I cannot afford to pay 500,000. So what do we do? What can Chidima do? Chidima, like you and myself, we need to have planning for our healthcare needs. Healthcare emergency can occur at any time. It can occur to anybody. The first thing is that our roads are not good. You are traveling on our road, you cannot guarantee 100% safety. The people are poor. So a lot of people are out of jobs. They don't have jobs and they must feed. So they go into armed robbery. You are working after working hours, you are going home and there's an armed robbery attack. So nobody can guarantee safety. So health emergency is something that is staring us in our face, but because we are so religious, we do not accept that emergency can occur at any time. So how do we plan for health emergency, which can happen at any time? Your healthcare should include healthcare needs, healthcare providers, and a budget. In today's Nigeria, if you do not have a health insurance, you are actually killing yourself. You are actually doing wickedness to yourself. Because the rich, the very rich, they don't pay out of pocket. If you go to developed countries, the only thing they enjoy, health, is a fundamental human right. It's not a privilege. So every one of them, they have access to healthcare because why? They are under health insurance by the government and so. So there is a government health insurance. There is private health insurance. There is state government health insurance. Like in Lagos, we have the Lagos State Health Insurance Scheme. There is a national health insurance. There's the basic healthcare fund insurance. And then the local government also are coming up with their own health insurance. It will surprise you that hospitals are now having their own healthcare package in form of health insurance. Why are they doing so? Because they've learned that out-of-pocket payment is the #1 reason for the poverty, illness, poverty syndrome. What is that? People are poor. People don't have enough money. Right now, everybody is just, I want to just survive. I want to eat. I want to be able to fend for my family. People don't take their cash out every time any longer because cost of fueling is so high. So when health emergencies come, the money they did not plan for, they are not rich, they move to illness, which is going to consume a lot of money. They make them become poorer, and then the circle continues. Poverty, illness, poverty syndrome. So how do we care for our health? Now we must ensure preventive health care. You don't have to be sick to go to the hospital. You don't have to be sick. In fact, the #1 role of health insurance is health prevention, disease prevention, and health promotion. They don't want you to fall sick. So if you don't fall sick, the money that they have given them to maintain your health stays with them. But when you fall sick, they use the money that is been given to them to take care of you. So they must make sure that you do not fall sick. And how do you ensure you do not fall sick? Please know your numbers. Go to healthcare facilities as regularly as possible. What is your blood pressure? What is your blood sugar level? What is your kidney saying? What is your urine saying? As simple as urinalysis will tell us a lot about what your kidney is saying. Have you done a pap smear? Have you done breast examination? Apart from self-breast, as a doctor, examine your breast. Have you done a mammo or a breast scan? These are areas where you can know your numbers. And if there's any area that is faulty, you can quickly address it. Then you need to eat healthy and you must exercise. It is said that exercise is the #1 drug, is the #1 treatment for hypertension, for diabetic, for arthritis, even for cancer. Exercise. Because by exercising, you are burning energy, which is derived from other substances apart from glucose. So when you exercise, it helps to reduce your blood sugar. It helps to regulate your cardiorespiratory system that regulates your blood pressure. It helps to regulate the fat content in your body. So exercise is the #1 treatment. But because people will not do exercise, because they will not do exercise, they will remain hypertensive for life. Chronic diseases have no cure. They can only be treated. So if you are not exercising, you are hypertensive, you're going to be on drugs for life. If you're not exercising and you are diabetic, you are going to be on drugs for life. If you're not exercising and you have arthritis, you will be on medication for life. So preventive health is the #1 thing every one of us must take home. And it is surprising, who are the major users of healthcare facilities? Children, because their immune system is not so strong. Women, because of the peculiarity of their nature, and the elderly people. So if the men say they are not going to hospital, please, women, be there. Be at the hospital. Make your doctor your friend. Make your nurses your friend. Call them as often as you can. Ask health questions. Google about health more than you Google about any other thing. Now, having talked about preventive care, how do you now also prevent ill health? By ensuring you have a health insurance policy. So the cure for out-of-pocket payments is health insurance. How does health insurance work? We pool money together. In my hospital, we set up a hospital in Ajegunle. And what did we do? We started doing what we call Ajo Health. Ajo means contribution. The same way the local people make contribution. So they contribute money, they bring it together, and then it is given to the hospital. About 100 citizens in a community, they pay 1,500 every month. Now remember, these are not sick people. These are people that are doing their daily daily work. They are paying 1,500. Instead of the money going to the alajo, going to the contributor person, we use it to provide health care for them. They are also still saving their money. The money they are saving is for their own business. Anytime they need their money, they collect their money. So it is a win-win for the patient, is a win-win for the hospital. So the money is available to the hospital to run the hospital. The money is available, the 1,500 times 100, that's 150,000, is available to buy the hospital drugs every month. So anytime any one of them falls sick, we do not look at them as one person that is paying 1,500, but we look at them as, oh, these people are paying 150,000 naira to the hospital. So we take care of them. So health insurance, there are various types. We have the National Health Insurance Scheme. Every government worker, federal government worker, is on the health insurance scheme. So imagine you, a private person, your friend is a federal government worker. You both go to the hospital. You are complaining hospital is expensive. Oh, their drugs are expensive. Your friend just walks in. They give him the treatment. In fact, he's selective of the hospital he wants to go. Only hospitals that give him quality, that's where he wants to go. But you cannot select because you cannot afford to pay for the essence of the quality that you want. So health insurance covers you basic health care, basic health needs. Now, with health insurance, there are exclusions. Not everything will be covered by insurance. That is where you need a health fund, a health savings. Because emergencies can occur at any time. And if your health insurance doesn't cover it, your health fund will cover the insurance, the emergency care. Most insurance do not cover cancer. Most insurance covers treatment to an extent. Sometimes it will tell you, oh, you have exceeded your limits. So you must also have a health savings. Do your research. You can have the National Health Insurance Scheme. The price is very cheap. You can go for the state health insurance. Whichever state you are in, a lot of the states are rolling out the insurance scheme. You can look out for the private health insurance. They are usually very, very good. They look at quality and they cover more things. You can look at your state health insurance, and also a lot of hospitals are rolling out what we call health packages. Just like in Orange Health, we have the Ajo Health. It's a form of health insurance to help the people, to help the community, to ensure that they don't keep complaining that, oh, hospital is expensive. They have a small amount of money that they contribute, and anytime they are sick, they are well covered. Next slide. So you must ask your question. You must ask your question about your insurance. It's not just picking anyone. What is your extent of coverage? What are you covered for? What drugs are you covered for? When you are giving drugs at the hospital, you must ask, what drugs are you giving me? Now, I must say that you do not need to be going to the tertiary healthcare center or the secondary. Your first point of call is the primary healthcare center. Look for the primary healthcare center in your place or a private health center around you. They can provide most of the services that you need. 80% of the services you need will be provided at that point. If there's a need for you to be referred to the secondary, they will tell you. If there's a need for you to go to the tertiary hospital, because a lot of people think that, oh, until I go to the big hospitals before I can get my care. No. Look for the nearest center to you where the basic health service, and that way you can be very close to your healthcare provider. In fact, your healthcare provider should be your friend. Why? Because you can get free knowledge, free information. Imagine if the doctor of your hospital is your friend and you can call him, you can chat him, you can text him. He will give you information that normally he will not give you, and it will be to your own benefit. Next slide. So various healthcare centers are available, and you must know your numbers. You must know what you need to do. Now, the National Health Insurance Program, we have the Basic Healthcare Provision Fund. Various states are using this. Majorly in the major cities, this is not so very, very big, but the National Health Insurance Scheme is very big. They have the geriatric home for the elderly people. They have packages for the young and children. So take advantage of it. And they are
Hello, Dr. Kunle. I think we lost Dr. Kunle.
on the National Health Insurance Scheme.
Welcome back.
On the National Health Insurance Scheme, you have a large pool of funds, and that pool of funds can cover you to a good extent. Next slide. So identify which insurance scheme is closest to you. The National Health Insurance Scheme, the Basic Health Insurance Scheme, the State Health Insurance Scheme, or the Private Health Insurance Scheme, or even the hospital-based healthcare packages. Now, how do you create your health plan? The first thing, what are your health indices? You must know your numbers. What is your blood pressure? What is your blood sugar level? What is your BMI? What is the level of cholesterol? Now, are you a male or a female? Are you still in a reproductive age? Do you have children? Are they still being immunized? Those are things that determine how much you want to estimate and keep aside for your health care. There are insurance packages also that they give you insurance and also give you health benefit. So you need to do your planning. So write down the names of members of your family and how much health care they will need. It's usually better that you have a health insurance than paying out of pocket. So your payment of out of pocket is going to be majorly on areas that are not covered by the health insurance. Include the healthcare need of each of your members. Is any of your child asthmatic? How often?
Hello, Dr.
will you
Kunle,
have
can you
to
hear
take
me?
her to the
Dr.
hospital?
Kunle, can you hear me, please? Just confirming. Sorry to
Yes,
interrupt.
I can.
Can you hear me?
Yes. I can hear you if you hear me.
Yes, Dr. Kunle, I can hear you. I think Elizabeth may be having some challenges with her internet.
I didn't get that. Can you come again?
Yes, Dr. Adekunle, I was saying that I can hear you. I think Elizabeth may be having some challenges with her internet connection. Please go ahead.
Okay. Next slide, please. So you must know the total healthcare package that you can spend, and that will be the budget you budget for the healthcare need of your people, of your family. But we'll encourage that the best of all healthcare plan is first to have a health insurance. So back to Chidima, or back to the woman that was pregnant. Now, for every pregnant mother, know that the pregnancy may be normal delivery or it can be cesarean section. So do not plan
Apologies, everyone. I think Dr. Adekunle's network is having a few hitches, but let's just give a few minutes for him to be back. Please, can anybody confirm they can hear me, just to make sure that it's not my network?
Yes, Dorothy, I can
Okay.
hear you. Thank you for
Okay.
that.
All right. Okay, I think Dr. Adekunle is
Sorry. So coming back to Chidima and the woman we spoke about, every pregnant mother must prepare for normal delivery or for assisted delivery or for cesarean section. Never think that, oh, I will born like the Igbo women, it will be normal. Sometimes the baby can turn. In fact, we do scan and we see some babies, they are jumping in the womb. They are happy. Sometimes the woman will just say, ooh. Why? Because the baby has jumped or the baby is kicking the mother. The same way the baby is happy inside the womb, he can turn. So how a delivery is going to go is totally, we cannot determine it. Most times we know the head is down, but what if it comes with the face when to be delivered? And there's no way the face can enter through the birth canal. So prepare for normal delivery, also prepare for cesarean section. So what does Chidima do? She came up with an emergency healthcare fund, which will act as a safety net that will protect her and to be in case of health crisis, and decided to save 1,000 naira weekly for this purpose. Just like we are doing in Orange Health, we are doing the Ajo Health. People are saving with us if they have emergency health needs. If they have emergency health need, already they have a form of health insurance, they are also saving their money. If they have emergency health need, we are able to take care of them, cover the basic, and if there's a need for additional payment, because they already saved, they have access to full health care. So poverty, illness, poverty syndrome is a big issue in our community because over 80% of people are paying out of pocket. Out of pocket. And out of pocket healthcare financing is very expensive. Not even in this time when the world is so expensive, when drugs are so expensive, you don't want to risk it. You don't. If you have a hypertensive emergency, you will pay with your nose. If a woman is pregnant and then she needs to have a cesarean section, she will pay with her nose or through her nose. Cesarean section used to be 250, 350, but now most hospitals, 500,000 naira. That is lowest hospitals. How many people are earning 500,000 naira per month? Or how many workers, or how many newly married people have 500,000 as savings? So anybody that do not have a safety net for his health is not acting wisely. In fact, the blunt is that he's acting foolishly because you do not have total control of your health. And especially a pregnant mother that is going to hospital to go and pay out of pocket for antenatal is not acting wisely. Is acting foolishly. Antenatal now costs minimum of 50,000 naira. And you must do 2 scans in pregnancy. And you have antenatal medications. And all these are covered by most health insurance companies. Why do you want to carry that burden? And then at the point of delivery, you are between life and death. You don't know whether it's going to be cesarean section, it's going to be normal. You don't know whether you're going to bleed. And then when you present your medical bill, you feel it's too expensive. Healthcare is not cheap. Health is expensive. I think I will stop here and I will allow people to ask their questions. Thank you very much.
Thank you so much, Dr. Kunle. Just confirming before I go ahead that you all can hear me. Dr. Kunle, can you hear me, please?
I can hear you.
Okay, great. All right. Thank you so much, Dr. Kunle, and thank you everyone for listening. I can see that some questions have started to come in already. I think this session has been really, personally for me, it's been very informative, recognizing the importance that, in fact, health is not just wealth, health is everything, and that wisdom is in planning for your healthcare expenses. It is wiser to plan for your healthcare expenses. I also saw the importance that Dr. Kunle mentioned of managing your health, that importance of self-efficacy, which is what we preach at MDoc, right? We encourage our members, we encourage everyone we engage or interact. Leverage coaching support, talk to your health coaches, ask your health questions, even with our AI health chatbot that's been integrated to our computer, you can ask questions about your health. There's also access to, exercise sessions. You can exercise, eating the right foods, the right meals, healthy eating, balanced diet, nutritious meals, and even just tracking your health numbers. A couple months ago, we had a session on knowing your health numbers, and we took the time to build our knowledge and our capacity on, what's the approved or normal range for blood pressure readings, for blood glucose readings, your BMI, even mental health numbers as well. So I'm really glad that Dr. Kunle took the time to provide this holistic overview for us to see that it's all connected, okay? Your wellness is built on the pillars of your lifestyle habits, what you do, how you feed, exercise, how well you look for health information, and also sharing for us to know where are the nearest resources we can get health insurance from the national health insurance to the state health insurance, from the Lagos state or from Ekiti state, our primary states we are implementing on other states. There is an opportunity for you. There's a provision for you. So we'd like to encourage you. It's so important. No one should leave today's session without learning that, their next step is to go and get a form of health insurance, because it is wisdom to plan, in case of an unexpected. And we've seen what the data is showing us, that it is unexpected medical emergencies can occur. So it is wise to plan ahead. And for our women of reproductive age, our pregnant mothers, it's important to plan ahead for your pregnancies, for your babies as well. Thank you once again, Dr. Adekunle. We're going to take questions now. So I'm going to read through the chat. I know there are some questions that have already been shared. The first one is, Dr. Kunle, can you share any other unconventional tips or lesser known resources that can help individuals navigate unexpected medical expenses? Loving the Ajo Health tip. Yes, I found that very interesting, the Ajo Health tip that the hospital is doing. So are there other ones like that, Dr. Kunle, that members can, or people who are joining, persons who are joining the session can take advantage of or can leverage to take care of unexpected medical expenses?
Majorly, you can talk to your insurance agent. One thing about healthcare is there has to be innovations, continuous innovation. When I was with one of the health insurance company, one of the things we did was I spoke with some insurance companies. I said, why not let's partner together? Let's inculcate healthcare into your other insurance program. And then certain amount of money that they pay comes to us. And they agreed. And so people have insurance, motor insurance coverage, and they also have health insurance coverage. We also spoke to the bank. Can it be possible that as people are saving with you, part of what you give to them is health insurance? So you are paying a small amount of money on their health insurance. And some banks agreed. So innovations around the healthcare space. And for us, that was how we came out with the Ajo Health Scheme. We said, what are the determinants of health? What determines that somebody is healthy or unhealthy? We call it the social determinants of health. And the number one factor is money, 40% social economy. So we now said, okay, what if, as a research project, we provide access to hospital? Can we use access to hospital to provide financial inclusion? So hospital begin to collect money from the people or organize the people into a group that is paying small amount of money for healthcare, because all of them cannot fall sick at the same time. The few that fall sick, they have enough money to take care of them. Any community can organize this. You have a health center in your community, organize yourself as a church. Organize yourself as a marketplace. 500 naira is not too much. When everybody pays 500 naira, that hospital in your community will come to your market to come and take your.
Sorry, just confirm. I think we lost Dr. Adekunle. But Dr. Adekunle, can you still hear me, please? Just confirming. Dorothy, can you still hear me, please? Just to
Yes,
sure.
Elizabeth,
I want to be sure. Okay.
Yes, we can.
All right. Okay. Thank you, Dr. Adekunle. I think he's dropped off now. Okay, he's back.
Imagine you're 1,000 people in your church and you all pay 500 naira per month. That pregnant mother, that money, 500 times 1,000, that's about 500,000 naira every month. It will cover all your medical expense. Remember, you have children in the church, they will fall sick. Remember, you have pregnant mothers in the church, they will deliver. Remember, you have elderly people that are hypertensive, diabetic. So you are not doing the hospital an advantage, you are doing yourself an advantage. So we, the people ourselves, we must organize ourselves and bring ourselves together to access healthcare. Health is
Thank you,
not
Dr. Adekunle. Can you still hear me? Okay.
Yes, I hear you.
Go ahead, Dr. Adekunle. I think there's a
can hear
slight
you.
lag, but I can hear you. Yes, I can hear you. Go ahead, sir.
Okay. So I was saying that health is not a privilege. It is our fundamental human rights. It is our I'll give you my story. I'm a doctor. I was working in an health insurance company, and I traveled to Edo State to go and inspect hospitals in Edo State. And I was coming back. I got into Lagos. I wanted to take a bus to CMS to go and attend a program called Experience. And at the bus stop, somebody came to my back, and the next thing I had was a gunshot to my neck. To my neck. At that point, I thought I was going to die. I said, praying, God have mercy on me. All my sins, God forgive me. And suddenly somebody came. I was asking for help. Everybody ran away. And somebody came and said, I know him. We were classmates in MBA class. That was how everybody came together. Because nobody wants police case in Lagos. So because of that singular person that said, I know him, I was taken to Lut. When I got to Lut, I had a CT angiogram. I was in Lut for 1 full month. I had 2 surgeries done. The pellets were removed. In fact, it just narrowly missed my major vessels. I did not pay 1 naira. And I was wondering how many Nigerians have died during emergencies by going to Lut. There's no bed space. But because I have health insurance, private bed space was provided for me. Throughout my stay in Lut, I did not pay 1 naira. No, imagine as a doctor, I didn't have a health insurance. And then I find myself in that kind of situation. Nobody knows me. They'll just tell me there's no bed. Because the emergency ward is filled with people who need healthcare. So I decided that if I could be saved because of health insurance, I'm going to give back. And that was how we started the Orange Health Initiative, which is an NGO. And Orange Health Initiative started the Orange Health Medical Center, which is a hospital. So now you understand why we are doing the Ajo Health. Because I was saved with health insurance. And I want as many people as possible to have a form of health insurance as possible. A lot of children will be saved in childbirth, in infancy, if they have a form of health insurance. A lot of young people, a lot of women who needs to have a cesarean section, they will not say no because of the cost of cesarean section if they have a form of health insurance. So what we are talking about is innovation in healthcare. A lot of innovation can come up that can ensure that we do not break our neck just to access health. I hope I answered your question.
Thank you, Dr. Kunle, for that very robust response. Yes, and I think it's important that you emphasize the importance of innovation, little ways or smaller ways that we can make sure that you are in some way, intentionally saving for your health. Through community-based initiatives like that, like the church. Almost everyone belongs to a church or a mosque, right? So having that's coming together, or even the state health insurance schemes as well, or the hospital itself, just making sure that you're not paying through your nose for unexpected medical expenses. Thank you very much. I think we have one more question. Is it advisable to keep elderly people in homes? That's the old people's homes. And how do I get someone in a government-run or government-owned old people's home? What insurance covers? Well, this is like 4 questions in one. Okay, what insurance covers elderly people care? Then we can take the next one. So let's take this first 3 and then we can see. Okay. Is it advisable?
Insurance that covers.
Yes.
Insurance that covers elderly people care. There's a national health insurance scheme. They have a geriatric health insurance plan.
Wow.
University of Ibadan has a geriatric center purely for elderly people. So you can enter the national health insurance scheme and ask them, or Google them and ask them about the geriatric health plan. Second, is it proper or is it good to keep elderly people in elderly home? Now, we will not say it is or it is not. The most important is that one of the key things that kills elderly people is lonesomeness. When you keep an elderly person at home and there's nobody at home, you've gone to work, your wife has gone to work, your kids have gone to school, you come back 8 p.m. If you're living in Lagos, the woman is bored. The woman is just thinking all day. The next thing is she wants to go, she wants to die. And lonesomeness kills them faster than any other thing. So if keeping them in elderly home, where they can have other elderly people with them, they can interact, they can talk, they can play games. If that is a better solution, please do that. There are also elderly people associations scattered all over Nigeria, where they come together occasionally so that they can interact. And if you're in a church or in a mosque, there's usually an elders forum. Ensure that they are part of it, they participate, because the brain needs to work. If they are professionals, they can volunteer. You can't compare if 25 years experience with someone that is just finishing school and is just, you can't compare the rag with the new clothes. Experience matters. Let them volunteer. NGOs, let them volunteer, even if it's 1 hour. These are things that move the developed countries forward. Sometimes they bring their old doctors. Let them come and work. Even if it's 1 hour, the experience they will give the younger ones. The managers, let them come and work. The artisans, let them learn, you see, mentorship. Let them mentor the younger generation. And then the younger generation is doing reverse mentorship for them. The younger generation is teaching them technology. Yes. That's reverse mentorship. And they are mentoring the younger generation in character, in experience. So please, do not neglect the elderly. They are as important as anything to us. Don't just dump them in elderly home. Let them be the one training your children. When elderly people see their grandchildren, it makes them so happy. In fact, my in-law used to take my children to school. He would go and pick them himself. That was good. He is so happy doing it. I don't even, sometimes I'm at work, I can't do it. But he's happy doing it because they make him happy. They will jump on him, and that gives them longevity. So dumping them in elderly home, it may not be the best, but if that is the only solution, please let them have association and access. So get them the geriatric health insurance plan from NHIS or the private elderly health insurance plan. It will save you a lot of money.
Thank you, Dr. Adekunle. That was very robust, the additional advice and, you gave. Thank you so much. I think one more question here is, can I register for another health scheme alongside Ilera Eco? I think that's the Lagos State scheme. So this person is asking, can they register for another health scheme, in addition to that one?
Okay. Now, is it advisable? The first thing is, what does your health scheme, what does it cover? You must know your benefit package. Then your provider, what are the things that they don't cover? Those are things to begin to look at, so that when you are registering for another one, you are not registering for the same thing, primary care, because the primary care will be covered majorly by most of the insurance companies. So look for additional care cover, or negotiate with your hospital so that the things that are not covered, you are able to pay at a discounted cost. If you decide to negotiate with them, they can ask you, okay, you pay this amount every month or every year as a form of health, as a form of insurance by the hospital, and you pay far less. So that things that are not covered by your HMO, you are still covered. And when emergencies come, it will not be an issue.
Thank you. Thank you. That's very, I think the central theme from, the conversation today has really been about strategy, initiative, just planning, thinking, how can I, look for a plan that allows me to plan as opposed to, facing unexpected expenses. So I think that stood out for me. And thank you so much, Dr. Kunle, for reiterating over and again. So if you are looking for another health insurance, make sure that it is, in addition, it's not something that is duplicating, but something that is an additional cover for something, for other benefits. The last question here What are some common mistakes people make when planning for medical expenses, and how can they be avoided to ensure better financial outcomes? I think we can round off for this last question, Dr. Kunle.
Let me leave that question to you to answer, because I am.
We would like to get your expert advice first before we trust a non-insurance expert to give that answer. So let's hear your thoughts first, and then we can. Thank you.
What the people make? People feel that they don't need to pay for health insurance. That I'm not sick, so why should I pay? So they don't pay. Even while their companies say, oh, we're going to deduct small amount of money, some will say, no, don't deduct any money from my pocket. So they don't participate. Unfortunately, it looks as if those are the people that really have the medical emergencies and they are stuck. Secondly, people think they are smart. They say, oh, they remove my money from the insurance, so I go to hospital every time. No, you don't just go to hospital and keep collecting drugs. The most important thing you need to do is to prevent diseases. Know your number, exercise, and diet. Those ones, it depends on us. You are the one that determines your diet, your food. Let your food be your medicine, and your medicine becomes your food. So anything unhealthy, you are living unhealthy. You're just going to hospital every time. You're not exercising. You're just jumping from one hospital to the other because they removed from my money. No. So those are mistakes people make. You cannot be wiser than Solomon. And then also, people feel that they won't give the right information to their healthcare practitioner. When you are lying to your doctor, you're actually lying to yourself, because some medications are dependent on the age. They're dependent on the sex. I can give misoprostol to a man for pain, but when I give it to a woman who is pregnant, she's going to abort that baby. So the information you have given me a wrong information about your age, even about your gender, or about your history, and then I'm prescribing based on the information you have given me. And then when things happen, you see so do not lie to your healthcare provider. Confidentiality is very, very key. Ensure that. I'm sure there are other ones we can add from the group.
Thank you, Dr. Conley, and thank you to the additional comments we've seen in the chat about the importance of preventive care, negotiating, and just making sure that you're making the best use of your health insurance plan. Thank you so much. And I'm sure that the answers have been very very helpful and very informative for all the questions we have around health insurance. My ask before we take our post quiz is to make sure that if you don't have a health insurance, you are making plans, you are thinking actively of the next steps to go get a health insurance plan today. All right, so we'll go straight into the post quiz. Dorothy, please over. Thank you. Okay, our post quiz is up now. We'd like to encourage everyone to please participate. If you took the pre-test quiz, please make sure that you're also taking the post-test quiz. It is important for us to be able to measure our knowledge gain from this session. So please make sure that you take the questions. There are just 7 of them. Thank you so much. Please keep your answers coming in. I can see that some persons have started responding already. Let's see more answers coming in. Your answers are anonymous, so don't worry about that, but just try to attempt so that we can see how we've gained knowledge and, from this session. Thank you so much, everyone. Please, if you're having any challenges locating the poll, please let us know in the chat box and we'll be able to provide support for you. But if you look at the bottom of your screen, there should be 3 dots or a button that shows more. If you click on that, you should be able to access the poll. But if you're having any challenges, please let us know in the chat so that we can support you. Thank you, everyone. I want to see more answers coming in. I can see that we're taking the post-test quiz. Please keep your answers coming in. Thank you very much, everyone. Our countdown is coming up shortly, but I want to give some more room for those who are already responding to complete their responses. If you've not yet responded, if you're just joining, you're just getting back into the room, please, you're taking the post-test quiz. We want you to attempt the questions, just 7 of them. This is going to be very helpful for us. So we encourage everyone, please make sure that you take the post-test quiz. Thank you so much. Thank you to everyone who has participated so far. We're almost at the mark. Please, if you are just taking the process, we will wait for you to complete it, but want to encourage everyone to please make sure to participate and take the post-test quiz. Thank you so much. Right, we have about 2 minutes to go. Please, want to encourage everyone, please make sure that you take the post-test quiz. especially if you took the pre-test, it's important that you take this as well. There are just 7 questions, so I want to encourage you. Please try to attempt the questions. Thank you. If you're just joining us, you came in at the right time. We're rounding up our post-test quiz, and we want you to make sure that you participate. We have just a few minutes left to round up the post-test quiz. So please make sure that you take the post-test quiz. Thank you. All right, we have 1 minute to go. If you are taking the post-test quiz, we're waiting for you so that we can bring this poll to a close. All right, so we're going to round this up now in the next 15 seconds. So thank everyone who has responded so far. So we need to bring this to a close now. Thank you so much for your responses. We have less than 10 seconds to go. Thank you so much. And we are done. Dorothy, thank you. Over, please. We can bring the poll to an end. And next slide. Okay, one more survey that we want to just take a quick poll. We want to know how your experience in this session, did it meet your expectations? What are some of the learnings? You can share that for us in the chat as well. Just 5 questions. We just want to quickly know how you enjoyed the session. Thank you so much. For those just joining us, welcome back. We're quickly taking the reaction survey. Want to know what your experience was from this session. Please As many people as are in the room, we encourage you, please take the reaction poll. Let's see if you enjoyed the session, did it meet your expectations? Thank you so much, everyone. Right, keep your answers coming in. We're bringing the poll to a close in 1 minute. Don't worry, this doesn't require a lot of thinking, just quick, and your responses are absolutely anonymous. We just want to know how your experience from the session so we can know how to improve and make it better for you the next time you join us. Thank you so much for your responses. I can see they are coming in quicker. We have less than 1 minute to go with this poll, and we'll bring it to a close. All right, 30 seconds to go. Okay, we're bringing the poll to an end now. Thank you so much for everyone who took the time to share their experiences. Dorothy, over. Thank you. Like I mentioned earlier, you can put in the chat box there the topics you'd like us to address, and we'll take note of that for future sessions. But I want to appreciate everyone who took time out of their Friday afternoon. You could have been at an OMB, you could have did something else, but you took time to come, participate, and enjoy the benefits of this rich, robust session. Like to encourage you, please stay connected, follow us on our social media platforms so that you can keep abreast of future sessions and other offerings that MDoc has for you, especially as regards your health and improving your health outcomes. Next slide, please. We'll play our complete health video clip just briefly, just so that for those who join the session late, we can also learn how you can sign up and download and sign up the app. Thank you.
This video is a brief walkthrough through our complete health mobile application. When you download the app, it takes you to this page, and then you can choose to either sign up or log in. To sign up, please include your first name, your last name, your email address, your phone number, and a unique password. Please ensure that the password is strong, it is unique, and it is imputed twice. After that, you can now create an account. When you click on create an account, a verification code is sent to your phone. Kindly input the verification code and your account will be active. Now you can proceed to fill in your profile. In your profile, you need to fill in your gender, your date of birth, your height, and your weight. Your height and your weight are necessary because this is required to calculate your BMI, which is your body mass index. And after that, you fill in your level of education and your income level. So after signing up, the next thing to do is to
Dorothy, can you still hear me, please? I think there's a small lag. Okay, I think we had a small technical glitch. I'm going to try and reshare that screen, please.
This video is a brief walkthrough through our complete health mobile application. When you download the app, it takes you to this page and then you can choose to either sign up or log in. To sign up, please include your first name, your last name, your email address, your phone number, and a unique password. Please ensure that the password is strong, it is unique, and it is imputed twice. After that, you can now create an account. When you click on create an account, a verification code is sent to your phone. Kindly input the verification code and your account will be active. Now you can proceed to fill in your profile. In your profile, you need to fill in your gender, your date of birth, your height, and your weight. Your height and your weight are necessary because this is required to calculate your BMI, which is your body mass index. And after that, you fill in your level of education and your income level. So after signing up, the next thing to do is to subscribe for a program. To do this, please go to the home page and click on your name. After that, click on profile information and then click on subscriptions to the right. This will take you through a list of the available programs at MNOC. So for the purpose of this video, let's select Propel and we'll select free version and click on checkout. Checkout confirms payment and immediately takes you to fill out a BLA, which is your baseline assessment. After filling the BLA, you'll be automatically assigned to a health coach. Now, to confirm your subscriptions, please go to your homepage and click on My Subscriptions. This will show you the list of all the programs you subscribe to, highlighted in green. You can click on the program to find out your assigned coach and also retake your BLA if you fail to do so initially. Thank you for watching this video.
Thank you. All right.
This video is a brief walkthrough through our complete.
Okay, and just a quick reminder about our Navi Health platform as well. You can get access to healthcare facilities around the country, depending on the care you are seeking, and you can leave reviews.
Hello, in this tutorial, I'll walk you through the sign-up process on Navi Health. The first step is to enter navihealth.ai into your web browser. Next, click on the sign up button you can find below. Choose from one of the options to register either as a patient, facility, or healthcare provider. Input your details. You can use a registered phone number or email address of choice, but please note that using a registered phone number is compulsory. Make sure to create a strong password. Once you have done that, click on the Finish button to be redirected to input a 6-digit verification code. Get this code sent to your email or your phone number and click to verify the button to complete the sign-up process to get started on Navi Health. Once the sign-up process is complete, search for a healthcare service close to your location, and once the result pops up, you can search for a facility close to your location. Once you search for a facility, you can click to leave a review on that facility. Make sure your reviews are 100% authentic and original. Input a display name which is not your profile, and thank you for using Navi Health.
Thank you so much. And this brings us to the end of today's session. I want to take time to appreciate everyone again. And thank you so much to our guest speaker, Dr. Adekunle. Thank you for taking the time to, share, rounded insights, practical insights, and even very innovative ways that anyone can plan intentionally for their healthcare expenses. I'm going away with many lessons. I hope other people on the call are doing so as well. I want to encourage you, please stay abreast, stay connected. We'll share the resources from this session afterwards, and we hope to see you again at our next session. Thank you once again for joining us. Have a wonderful evening. and a wonderful weekend ahead. Goodbye for now. Thank you.